You are here to witness the distribution or the initiation of our second phase of the CSO COVID-19 response. At the onset of the COVID-19 pandemic in Ghana, the platform, together with the strategic partners, set up the CSO COVID-19 Response Fund. This fund was to locally raise money from CSOs and other individuals who align to our cause. And it is to support government's action in terms of alleviating the plight of the poor and vulnerable in Ghana. Ladies and gentlemen, I'm happy to report that since the setup of the fund, we have been able to raise 119,712 cedis, 62 pesewas. These contributions came from 78 contributors. As part of that, the phase one, we were able to distribute 230 bags of rice, 210 gallons of oil, 210 containers of soap, and 20 packs of vitamins to over 1,437 people within Greater Accra, Kaswa, and Kumasi. This comprised of 519 street children, 258 aged and widows, 308 mentally ill persons, and finally 352 persons with disabilities. The phase two of the fund therefore seeks to focus on addressing behavioral issues that will help citizenry comply and conform to the accepted social distancing and safety protocols. Hence, the phase two seeks to distribute 5,000 face masks to the poor and vulnerable. We are also distributing about 9,000 information education materials to facilitate sensitization efforts nationwide. And we are targeting persons with disabilities, we are targeting street children, the aged and mentally ill nationwide.
So the phase two seeks to provide face masks and IEC materials, and the rationale for the provision of the face masks and the IEC materials is because at the moment the current restrictions, the relaxation of the restrictions makes it important to provide these items for people to be able to abide by the compulsory wearing of nose masks. We also think that in order for us not to lose track of the progress that is being made, people need to continuously be informed of the social distancing and safety protocols. And so the messaging in the IEC materials is to help our partners, help our conveners be able to carry out sensitizations across the country.
As a member of the Ghana Federation of Disability Organizations, we are indeed happy that this intervention has come through. Ever since the COVID-19 came into our space, it has really worsened a lot of, issues relating to persons with disabilities, especially access to health care and, this and education is also one of the things that has gone on, but you also understand that not everybody has access to some of these televisions, sets or radio, or people in the hard to reach areas. And so we are happy that these relief items are coming, and we will share them to the members of the different organizations. And it is our hope that this will go a long way in helping them understand what COVID is, and also with these PPEs it will also help them as we are all striving to curb the spread of the virus. Thank you.
So today we are here on behalf of the Ghana Civil Society platform, the Civil Society Organizations platform, and we are representing the Volta region. So we have the national office. So in efforts to curtail the pandemic, the National Secretariat donated some nose masks and some materials, some very educative materials, infographics. Yes, I'm sorry we don't have it in braille form so that we can all understand it, but it's a lesson to us. We'll send feedback back to the Secretariat to let them know that we are leaving some of us behind. Yes. As a civil society organization platform, we've realized that the COVID-19 has been a global issue nationwide. So today, as efforts to help curtail the pandemic, we are here at NHFB to donate some items.
A very big thank you to the National Civil Society Organization platform on the SDGs for remembering reaching out to those who are not in the urban areas also as well, and reaching out to those who are PWDs who don't really have access to most of the PPEs that have been donated. With their help, we have been able to give out to the New Horizon Foundation today, and without the collective support, it wouldn't have been a success. Though everything has been done, still we have certain few challenges that we need to get to.
So some of the challenges we encountered was that these are persons with visual impairment and therefore are not able to see what's on it. So possibly it could have been a braille with the stickers, or you have it in an audio format, or better still, you have it in a soft copy where they can then be able to put it on their devices and then read through a screen reader.
We want to take this opportunity to thank the Ghana Civil Society Organization for thinking about us to bring us these items in order to fight the pandemic. Really, it has come at the right time. And also we want to thank the whole platform for remembering the Education Center for the Blind, where we work for children and young people who are totally blind and other disabilities, to have this very important item to protect them, because as persons with blindness, our challenges are observing the social distancing, and we need to protect ourselves in this time. We also want to be show appreciation to my colleagues who made it possible to bring these items to the facility. Thank you so much.
I'm Dozie Jima, a member of COVID-19 Response Committee team, and I was the one that led the distribution of the relief items in Ashanti region. Kumasi, which is also a member of the affected regions, we also received the package relief items. So we targeted the aged in the Greater Kumasi, sweet children, because they were also affected. They used to be begging. If the restrictions have been put on movement, we saw that they are really in distress. Men, the people with disabilities, the mentally retarded people, so we also reached out to those in the mental homes, and then we distributed relief items in the form of food.
their bit again to bring us some items to help fight COVID-19. This afternoon, we've invited some organizations to come and take delivery of a few masks that have come in. And these masks are supposed to go to street children again, people with mental issues, some widows, and people living with disabilities. We have invited a few of them. And so the items will go to them. Going forward, all we will say is that we are appealing to all and sundry to come to our aid. As CSOs working on the SDGs.
At this juncture, I want to thank all those who contributed money towards this fund. And for the pictures or the visual they've seen, they realize that the money was put to proper use.
We are also doing this in the spirit of leaving no one behind. That is our benchmark right now. As you know, CSOs working on the SDGs, we want to make sure we don't leave anyone behind. And basically, the deprived are those who are highly left behind in this cause.
Members of the Ghana Federation of the Disabled, Katsina and Kana West, China Zone specific, the West. And today we are meeting to donate nose masks donated by the CSO platform in Katsina and Kana West for the vulnerable. And they are all grateful for the donation and wish that the platform will grow and be able to help them achieve their dreams in life, especially in advocating for the proper disbursement of the disability fund.
Our message to everyone is that the COVID had come to live with us. And then it is one thing you cannot see. It is faceless. And it is amongst us as human beings, even as we interact with ourselves, the COVID is present. So we are encouraging everyone to continue to adhere to the COVID-19 principles. We are encouraging everyone to use the nose masks we have provided, and also the IEC materials that we have provided. We have shown the symptoms and what to run away from. We have also shown what you should do in terms you are engaging people. So this is the NGO coalition, that is the Ghana CSO coalition on SDGs. This is our response to COVID-19.
SDGs,
leave no one behind.